The Upper West region has recorded 3 more deaths from the outbreak of cerebrospinal meningitis, taking the death toll to 43 and 273 infections. Deputy Minister of Health, Dr. Okoboy, who is in the region to assess the situation, has meanwhile reiterated government's commitment to fighting the outbreak. Upper West Regional Minister Dr. Hafiz bin Saleh stated government is treating the issue with all seriousness, adding they're doing everything possible to bring it under control.
The 2-day working visit to the Upper West region by Deputy Minister of Health, Dr. Okoboy, is to do a close review of the various strategies employed by the various districts and municipal public health epidemic management committees in the region to fighting the high number of fatalities on the cerebrospinal meningitis (CSM) and their preparedness to combating the COVID-19 pandemic. Whilst in the region, he is scheduled to meet major stakeholders in the health sector, including traditional and opinion leaders, and visit some centers where COVID-19 patients are being held. Dr. Okoboy's first point of call was at the Upper West Regional Coordinating Council, where he paid a courtesy call on the Upper West Regional Minister, Dr. Hafiz bin Saleh.
In the case of COVID-19, we have recorded 8 cases, and all the 8 cases are doing very well. On the part of CSM, as of now, we have recorded 273 cases with 43 deaths, and this is not pleasant at all. Since the situation became unbearable, we have had cause to inform the Ministry of Health as well as Ghana Health Service, and they have not taken their eyes off the ball. In fact, the Director General, Ghana Health Service, a few weeks ago had to deploy the Director Disease Control and Prevention Department of Ghana Health Service to the region. He came, assessed the situation, and has since presented his report to the Director General.
Dr. Okoboy reiterated government's commitment to fighting the CSM epidemic and other infectious diseases in the country. He said the loss of 43 persons in the region through CSM cannot be allowed to continue.
Government hasn't taken its eye off the ball when it comes to other health conditions. We are dealing with COVID-19, but we put equal importance on conditions like CSM. When you look at the WHO protocol, the case fatality rate that is accepted or more or less considered as normal is when it's less than 10%. But we know that over the past few months, when you look at the cases from the Upper West, we've gone to about 15 or so %. So we appreciate the fact that it is quite high, and my small research has shown that some of the strains of bacteria that we are dealing with now is not the usual ones that have vaccines readily available. We are dealing with Sero-X, I am told, and the plan is quickly to find a way to encourage and educate people to do early reportage to the hospitals. I believe I'll get to know more as we interact with the stakeholders and the managers of the situation.
Later at a meeting with the Upper West Regional Public Health Epidemic Committee, outgoing Upper West Regional Director of Health Services, Dr. Oseko Afrea, threw more light on the district municipal distribution of the CSM cases, stating that all confirmed cases have been treated and discharged, except 5 who are currently receiving treatment.
So these are cumulatively the number of cases that we got. So if you take the 43 out of the 273, then obviously the rest are cases that have recovered and we have discharged them and they are living a healthy life. Exactly, because others have been treated and discharged. So if you go to Nadoli right now, they have just 1 case, which is an under 10-year-old child. You go to Jirapa, there's no case on the ward. You go to Nandom, they had 2 cases yesterday, and this morning they brought a 45-year-old presenting with signs.
Reporting for Joy News, RAFIQ SALAM.
And regional correspondent RAFIQ SALAM joins me live with more. RAFIQ, did you get a sense of how differently government is seeking to tackle the CSM outbreak after the Deputy Minister's visit?
What transpired yesterday regarding the address that was made by President Akufo-Addo, because the people in the region felt that they were left behind because of the advent of the COVID-19 pandemic. Because the feeling was that government has relegated the issues of CSM at the background. You remember the past week, 40 people lost their lives in the Upper West region, and then also taking that or comparing or juxtaposing that with the issue of the COVID-19, where about 9 people also lost their lives. And so the people in the Upper West region thought that, yes, we have many deaths. The issue is in CSM, but the president is not talking to the issue. And so when the president made the pronouncement yesterday about reassuring them that government was committed to fighting the CSM and other infectious disease, it was really pleasing to hear from the people of the Upper West region. And so today there was a lot of excitement when Dr. Benadoko came around and then he visited the Upper West region. He met the Upper West regional minister and also met the overlord of the Water traditional area. There was a lot of excitement that government really was serious in fighting the CSM menace in the region.
Now, RAFIQ, which of these two health issues are residents of the region more concerned about, CSM or COVID-19?
The people of the Upper West region are more concerned about CSM because when you take the statistics, 43 people died from CSM. And in the case of COVID, there have not been any deaths recorded in the region yet. The region only had 8 people confirmed positive to have the coronavirus. But in the case of CSM, 273 people have been confirmed to have the disease. And then also, as I speak to you now, according to the Upper West Regional Director of Health Services, Dr. Sekufo Afrey, is saying that even the 273, about 258 has been treated and discharged. And so the people of Upper West Region are really worried about CSM more than COVID, because for them, they see CSM as more of a killer than COVID-19.
All right, thank you very much, Regional Correspondent, Upper West Regional Correspondent RAFIQ Salam. Moving on, the minority in Parliament is demanding accountability from the Ministry of Health on how it spent more than 4 million cedis disbursed since 2019 to fight cerebrospinal meningitis, which has now claimed 43 lives in the Upper West region. According to ranking member of the committee, KWABENA MINTAH AKANDOH, 4.1 million cedis have been allocated from the National Health Insurance Fund since 2019 for immunization, in addition to the allocation from government. He is questioning why all the funds could not have prevented the deaths.
I feel sorry and get very devastated when I find myself in this situation. You know, just like we started during the COVID-19 era, calling on the president to give it the highest political consideration, and we were taken to the cleanest. Joseph, you and I have started conversation on CSM, not today. Now we've lost 40 lives, more than 40 lives. Why must it take the president this long time before he responds? All the 40 people didn't die within a day. Meanwhile, provisions have been made in our budget, in the National Health Insurance Fund formula. Why must it take us this long? I am sad that these are avoidable deaths. For me, we could have avoided them, could have done, well, I will not say that you can avoid completely without anybody dying, but we could have at least, immediately we saw the trend, we should have done mass immunization. And for the past 2-3 years, they have not done mass immunization. Meanwhile, every year, we have provisions for them.
So where does the budgetary allocation go? Well, is that the money doesn't get released eventually?
Well, you have to ask the executive. Because as far as we are concerned, they get here and we approve it for them. And I can show you samples of those things, especially in the formula, CSM. Last 2019, we gave them 2.1 million Ghana cedis in the National Health Insurance Formula alone, not to talk about the main budget. In the 2020 budget, we gave them 2 million Ghana cedis. Where is the money? So you see, when it gets to this level and government pretends as though they care for the people, it pains me. You don't wait till things get out of hand before when people have lost their loved ones, when we are talking and people don't listen.